name is Maggie Palco. I'm enrolled at Muskogee University in their Nursing 335 Health Assessment class with Professor Anna Perky, and this is my health assessment. My patient is a 25-year-old male. I introduce myself, ask if there's any type of ailment that brought the patient in to see me today. He describes no ailments. I obtain a brief medical history, and then I start my assessment. I go ahead and obtain my vital signs. I get a supine blood pressure reading, sitting, and then standing reading on the arm. I obtain pulse rate, respers, height, weight, and then I move on with my assessment. The patient appears a normal appearance with no obvious deformities. I'm starting with the eyes, and I assess the accommodation of the pupils. They're equal and reactive to light. I inspect his ear canal. I do the finger brush test on both ears, a whisper test on both ears, and hearing is within normal limits. Inspect nasal mucosa. Mucosa is pink, wet, good health, and inspect the mouth, oral mucosa, looking at the dentition and palate and gums of the patient. They're all within normal limits. I next assess the respiratory status of the patient, listening to auscultating lungs from behind in all the quadrants, and then in the front on all the quadrants. That time I'm also going to assess heart function, listening for heart sounds, a normal S1, S2 without murmurs. Rate is regular. Respirations were regular and easy. Then I'm going to have the patient lay back, assess the abdomen, palpating for any masses, any tenderness. The patient has no masses and does not have any tenderness. I'm also going to have the patient sit back up, and I'm going to feel the neck area, looking for any masses, looking for any enlarged lymph nodes. Come down and assess that in the axillary region on both sides. Have the patient lay flat, inspect the groins. There's no masses, no enlarged lymph node. We would then do our GU assessment, which we're not going to do at this time. I will finish with pulses, dorsalis pedis and the tibial, posterior tibial, bilaterally, are both present. Have the patient sit back up, and we'll do a neurological exam. Through talking with the patient is alert and oriented to time, place, and date. Have the patient do a facial test for the facial droop with a smile, tongue's midline. Bilateral grips are present, as well as the foot push and pull. Have the patient walk, make sure the gait is normal. Also look at range of motion of the musculoskeletal system, is within normal limits. Evaluation of skin appears to be warm, dry, and pink, intact. No obvious sores or reddened areas. No breakdown noted. We assess the hearing. Assess olfactory with a smell test. Appears to smell equally. Cranial nerves with the cotton test for the trigeminal nerve is apparent on both sides. Patient's mood and affect is good without signs of distress or depression present. Patient verbalizes no needs at this time, and our health assessment is